Okay, let's start. Welcome to Godly Women Matters. My name is Roseline Nelson. I am married. I am a wife. I'm a mother. I'm a nurse by profession. And by the grace of God, this vision has been given to me right from when I was in School of Nursing, and that was 6 years back. And by the grace of God, all of those visions that were given to me 6 years back is materializing right before me. And here with me is Mrs. Tomisin. I will give her the opportunity to introduce herself. Let me not say much. Ms. Tomisin, please introduce yourself.
Thank you, ma. Good evening, ma. My name is Miss Tomisin Martins. I'm 29 years old. I stay in Ibadan.
Okay.
Thank you for having me here.
You're welcome, ma. So you did not say the part that you are a sickle cell warrior, because that's the major reason why we are here.
Okay, ma. Sorry. I'm a sickle cell warrior, and I thank God for life. I'm grateful I'm alive today.
Glory be
I'm
to
grateful
God.
to be here. Yes, ma'am.
Thank God, thank God. As we know that Godly Women Matters is a spiritual platform, we wouldn't do anything without committing this program to God's ends and starting with prayers. So let's bow down our heads for prayers. Father, we thank you for this privilege. We thank you for this opportunity. We thank you for this platform. We thank you for Godly Women Matters that you have been using to bless life all across the globe. Thank you for the followers. Thank you for myself. Thank you for Ms. Tomisin that is here this evening to share our experience as a sickle cell warrior. Lord, we give you glory. We say, may your name be exalted in the name of Jesus. And we are opening this program in the name of the Father and of the Son and of the Holy Spirit. Thank you, because we know you have answered. In Jesus' name have we prayed. Amen. So, Ms. Tomisin, you just said you are 29 years old and you are a sickle cell warrior. So can I ask you, how were you able to dictate, or at what age were you able to dictate that you have sickle cell?
Okay, ma'am. I'm 29 going to 30 by July.
Okay.
So,
and you look younger than your age, though.
Thank you, ma. Thank you so much. So, according to my mom, the first time I fell sick was when I was 4 years old, and that was when they detected that I had sickle cell. So it was at the age of 4.
Okay, so at the age of 4, that was when they detected. What did they see? What symptoms, what signs did they see that made them visit the hospital to detect?
Okay, one of the major signs of having a crisis, or that happens to let me rephrase that. One of the major sicknesses that happens to sickle cell warriors is one of them is malaria. So I had a chronic malaria. I had a very chronic malaria. I remember my mom telling me that my urine was very dark, and they told her one kind of, I've forgotten the name of the kind of malaria. It was very chronic. So that was what got us to the hospital before. So along with the malaria was the crisis.
That's serious.
So
okay, before we go on with hearing your experiences with sickle cell, I think it's important to make people that are hearing us to know what sickle cell is. What is sickle cell? And according to the flyer, we say we want to make people to understand why genotype compatibility is very important, especially among singles, to be able to understand their genotype so that they will not make mistakes that our parents have made, and so that they would not give birth to children that would be a burden to them, both financially and otherwise. You understand me? So it's important to make those listening to us to know what sickle cell is. Would you go first or should I do that?
And anyone you choose, ma.
Okay, tell me what sickle cell, because you have the experience. So I will just come from the medical aspect of it.
Okay, you do the medical, let me do the layman term. The way the way just to explain, it's an inherited blood disease
Okay.
that is passed down by blood from the parents to a child. So and this disease is actually caused by two genotypes that come together when they don't match. So it causes a defect in the blood and gives the child the blood disease, which makes the child to live a life of pain. So that is how I can explain in my own little way.
Okay, so thank you very much. Like in in medical terms, sickle cell disease or sickle cell anemia is a disorder that affects the blood. It makes the blood to have this sickle-like shape. That's this half-moon crescent-like shape. And the normal shape of the blood should be round and flexible, because when the blood is going through the blood vessels, it should be round and flexible so that it will be able to go through without any obstruction, without any interference. But now the blood of these sickle cell patients are sickle shaped. And as a result, not just that it is sickle shaped, it is rigid. So it is difficult for it to maneuver through a blood vessel that is bent. And it's also because it is rigid, it gets to a point when those blood vessels aggregate at a point, making it difficult for blood to flow. And that is when they start feeling pain. And all of this happens, although it depends on individual. For some, they have their crisis regularly, like every month, every week, they have to visit the hospital. For some, their crisis is once in a month. For some, it might be twice in a month. For some, it might be 2 times, like once in 2 months, and like that. So it varies actually. Okay, so let me ask you, how was it growing up as a sickle cell warrior? The pains, all of those things you went through. How was it growing up?
Thank you, ma'am. While in my early stage of life, I just know my body was in pain. I didn't understand what was really happening, even though I knew what sickle cell was from a very little age. But me being in pain, I remembered, I think I started getting more aware of myself at the age of 5. I have my memories most from 5 years old. Even the time mommy said I was diagnosed of sickle cell, I don't have memories from that. So
Yeah,
my
still
memories
young
from when I
then.
was 5. Yes. So when I was 5, I remember even on my birthday, I had a terrible crisis. I was so painful and everybody was trying to rub my body, trying to use hot water, trying to do this and that. I know that after a few hours, then I was able to sleep. So, but uh, the more I became aware, the more I was able to accept what was happening to my body, and the more I was able to live with it, and I I decided to just, you know, uh, being born in a Christian home, you are made to have hope and faith that one day you are going to get healed. So I had that faith from when I was young, and all I know is when I am in pain, I call on God, I call on God and beg Him to just give me relief and all that. Sorry, Mark, can you repeat the question?
I think yes, yeah, on the path. Yeah, doing. So okay, now like from what you have said, what I was able to get, you said you even had crisis on your birthday. And one of those things that causes those crises is stress. You know, sickle cell patients, they can't do, you can't play like normal children. And you know, at that
Yes,
age,
I
you want to
witnessed.
do what others are doing, you want to play football, you want to run around like others, but
Yes,
you just see
me
that,
especially.
hmm,
Yeah, you're right.
hmm. Yeah, but
Me
because of
especially.
the condition, you just see that when you do anything exhaustive, you just start having crisis. And another thing is because of that stress, you just see that there is lack of oxygen because it's this blood that is carrying oxygen across the body. And when there is lack of oxygen across the body, you start feeling pain, you start having all of this crisis. So that was the reason for that crisis, even on that day. And it even brings me to the point when you said, being like you are brought up in a Christian home and they make you believe that, okay, you would get healed, like have faith in God. Yes, I'm
Yes.
not ruling out the place of faith. And that is why knowledge is very important. Knowledge is very important. And that is why we are creating awareness of this sickle cell disease so that you will not say, oh, I am a single, I am AS, and the brother I want to marry is also AS. And you say, I have faith, or when we get to the bridge, we will cross it. So there is a place of faith and there's a place of knowledge. If the Lord is not leading you, don't say, when we get to the bridge, we are going to cross it. Don't push yourself into it and say, but I like this brother, or the brother is handsome, you know. This brother, will not let this brother go no matter what. We would find a way to do it. So it's very important. There is a place of faith and there is a place of knowing the will of God before you go into marriage. Okay, Sister Miss Tomisin, how was as you were growing up, you told me about your family, the relationship between your father and your mom. Can you just tell us about it? Yes, let me not go into it.
Okay. Yes, to emphasize more on what happened to me when I was 4, I started falling sick because my dad traveled out of the country at that age, saying he wanted to go for greener pastures, which as a 4-year-old, I don't know what that was. So all I knew was I was missing my dad, and that was what led to me falling ill. So it took a while for me. It took many years for me to accept that my dad was not coming back, because over the years, I and my mom had the hope that he would come, but he didn't. He promised he was going to take care of us. Even he stopped my mom from working. She was a government worker at that time, but he said I needed all the love, care, and attention I could get. So my mom had to resign to take care of me. So which all we know was we hear from him maybe once a year, once in a few years, and we thought maybe it was because there was no means of contact. So I remember seeing a few letters that he wrote, sent to me and my mom then. So, but after a while, my dad, started another family over there, and the relationship kept getting further. So I've only seen my dad a few times in my life, and I can't really say this is what I know about him, but as I kept growing up, we were not very close again. So I just know he sends money sometimes while I was growing up. So, but after some time again, he stopped for many years. Then I remember while my mom was trying to build a house, my dad sent money during that time. He was sending money for the house then. So, but we having a father-daughter relationship like that was not really there, but I just kept that hope. I guess I just had hope surrounding me hoping my dad will come back one day and we'll all be together. But the very first time after he left when I was 4, the first time I saw him again was I think that was 2002. No, that's 2002 or 2005. So that was what happened.
Okay, so in continuation of what you just said, I want you to just say something about people that used to say, okay, you know, when we were in secondary school, we do this matching, and they will tell you if you are AS and AS, when you match it, like you do those matching, first it will come up with AA, AS, AS, and then SS. So people have this misconception that, okay, at least my first child will be AA, then the next one will be AS, and at least if I have 2 children, it's okay, we'll stop there so that we'll not have SS children. So what do you have to say about that?
I'm using this opportunity to tell everybody that please cancel that notion totally. Cancel it very, very totally, because it is a very, very wrong notion. I've met many adult sickle cell patients that even got married to AS, that thought their first few children would be AS, you know. So they went ahead giving birth to these children. And I met the couple who were both AS, and the first 3 children were all sickle cell patients. It was only, they gave birth to 5 children. The first 3 were sickle cell patients. So it was only the last 2 that were not sickle cell patients. So if it happened that some people first had AA and AS, it was just their luck. So please cancel that notion, because, you know, how do I put this? There's something Yoruba says that God does whatever he likes. I don't know how to put it in English. Asheyowu lolong is whatever he likes, he does. So you cannot predict the move of God and say, God, or don't think you can pray your way into it, that God, I just want to have 2 children, so let them be AA and AS. No. I will advise that people should please cancel that, because you can't test God. That's just it. You cannot test God, and it is even in the Bible that we should not test God. So even though you are Christian, you have faith, you heal the sick and raise the dead, I don't think anybody, even Moses in the Bible, would want to do that. So please let us cancel that notion and follow procedures, follow what you're supposed to do, and ask God for directions in life. Don't decide for God. Yes, ma'am.
So you don't say, I know that what I'm doing, it is not, there is implication for it, so, but let me just go into it. At least God will see me through, or God will waive those, God will waive that, so that I will not have SS children, and you testing God. Thank you very much. I want you to use your own personal experience so that we would be able to understand it better, because you said you are the first child. You are the only child of your parents, right? You are the only child of your mother. Okay, you are the only child of your mother, and you are SS. That means you are the first, and you still have this SS traits in you. So it just shows that it's not about, okay, the first will come out to be AA, and at least if I have 1 or 2, I will stop and I will not have SS. It doesn't work that way. So I think we need to talk about that, so that people would, it's just a misconception, so that people will be able to understand it well. And I have to say, Ms. Tomisin, you are so lucky, because it was at the age of 4 that you started having these signs and symptoms. That was the time they took you to hospital thinking it was malaria, and before they discovered that you have this sickle cell disease in your blood. Okay, because I have seen children, even less than a month old, having crisis.
Exactly.
less
Exactly.
than a month.
Yes.
Imagine a mother
It's
that
not
just
baby.
gave birth, that is still trying to heal from all of those pain of childbearing, and all of a sudden you discover the child is SS, and financial complications, the financial
I'm sorry to say, ma.
implications of that. Yes, ma'am.
I'm sorry to say, ma. What you just said, I don't. I'm sorry. Let me
Mm.
just unapologetically. I'm not sorry for such mother because it is that baby I'm sorry for. You know, a baby that is just trying to know what is even happening to him. What is
Mm.
going on, that is just coming into this world
Mm.
and now having to have crisis. A baby that cannot talk and say, this is where it's paining me.
Mm.
It is the baby we should be sorry for. You know, it is that baby we should be sorry for. I, at
You're
the age of 4, could still say, Mom, this is where it's paining me. Yeah.
mm.
I've met sickle cell patient. We have one of the star sickle cell patients in Nigeria. She has a foundation, Pearl Sickle Cell Foundation. She did not know until she was 18 years old.
Mm.
She didn't know
Mm.
until she was 18 years old, and she's so lucky.
She's so lucky.
So, but those babies were not lucky, and it is a very painful thing. Whenever I think of it, it breaks my heart a lot because these babies cannot express themselves at all.
Mm.
They are still getting used to the breeze that is blowing them, the noises they are hearing, trying to open their eyes, trying to notice their surroundings, and then this is happening in the early stages of their life. It is the most painful thing.
Mm.
So even though the parents might not be at fault, I know people might criticize me for saying I don't pity the parent, but
Because
I
I
know the parent
understand
might not be.
some people might not, and I'm not
Yes,
surprised that some people don't even know what genotype is.
I
So
am not
they don't
surprised at
even,
all.
yeah, some people don't even know what genotype is. So they did not even check, not to talk of checking the compatibility before going into marriage. So ignorance is
Yes,
not an excuse here.
that
And
was
that's
what
why,
made me start this going about talking about sickle cell, and even the sickle cell programs I started. Actually really started from TikTok, not Facebook. I
mm,
was doing it I was just doing sickle cell awareness because we have World Sickle Cell Awareness Day every year, and we have
okay,
World Sickle
which
Cell
day is that?
Awareness Month. Oh my God, forgotten. I think it's June 20
Okay,
something.
all right, okay.
Yes, ma'am. So
The
I'll
same month,
Google it.
that's the, so June
Yes.
is the sickle cell awareness month too.
No, it is in September.
September is the month, okay.
We, yes, we use the whole of the month to
Wow,
create awareness about sickle cell.
wow.
So I was only doing that until I got on TikTok, trying to know how TikTok is, and just doing my thing during sickle cell awareness month. When
Hmm.
I met someone that asked me that, what is genotype? I've never heard of genotype. This guy stays in Dubai. He's a
Hmm.
Cameroonian guy. And he was like, what are you talking about? What is
Hmm.
genotype? I was
Hmm.
like, are you joking? Are you joking with me? And he said, no, I'm serious. I've not heard of it. And this
Hey.
guy had to go and call his other friends to come and listen because he was so surprised and said he doesn't even know someone is even can be facing such. He's never heard of it in his life, you
Wow.
know.
Wow.
So this is why we need to stop. We need to try to create more awareness because there are many people that just keep falling victims, and we have the laboratory errors as well that is
Hmm.
pushing people
Yes.
into
Yes. Thank
into
you for
into
talking
falling
about that.
victims. I
Yes.
always emphasize it. If you want
Hmm.
to know your genotype before getting married, go to 5 or 6 different labs.
Hmm.
Go to
At
five or
least
six
three.
different labs
Hmm.
because the
Because
majority that gives you the one that gives you the majority of results will be the one you can
you are
choose
right
from.
here. You are very right. There are
Yes,
people that they will tell you, I have done it before. I am AA. All of a sudden, how
yes,
did it become AS?
yes.
Because they
Imagine
just
a
believe
husband
that,
and wife
hmm,
thinking they are both AA, or one is AA, one is AS, and they get married and discover
hmm,
that they are both Yes, but before then, before they will even discover, the husband might think that the wife was cheating on him, and causing conflicts in the marriage. I've seen it very well. It has turned marriages upside down. Many of them, thanks to their doctors that help them to, solve the puzzle, what is puzzling them, they don't understand. Many of them, it was their doctors that helped them. So imagine the ones that are not educated that suddenly have a sickly child, and the other children are healthy. Maybe they don't even know their genotypes, but they just know they have healthy children and just one is sickly. And what they say is that child is a bastard, or the child has evil spirits. That's what those children, that's the kind of stigmatization those children face. And the mother will be victimized, and they punish the mother for bringing a bastard to the family, and they say, why is the child different from the other children? Sorry to cut you off then.
No, it's fine, ma. So let me just emphasize it here. Know your genotype. Like I'm talking to those that are listening to us. Know your genotype. Be sure you have done the test in at least 3 places. In fact, if you want to do more, be sure to do it at least 3 hospitals, and not just any kind of hospitals that don't have the right facility, that they will just do something and tell you this. I like probably government hospitals or private hospitals that is tested and trusted, and do it in like 3 places to be sure of your genotype. Okay, I would like to come to the financial implication, but before we go there, we were talking about even children less than a month that are having crisis, and you said something at that point. You said at least at the age of 4, you can say, mommy, this is where I'm feeling the pain, and they will be able to help you. Imagine that child that will not be able to, like if a baby, that will not be able to say, okay, this is where the pain is, this is where the pain is. And crisis in sickle cell is not something that you say, okay, it's only the bones. Most times we think it's only the bones, like they usually have bone pain or joint pain. It's not just the bones. Can you just expatiate on that? The pains, the severity of the pains, and the different parts of the body where the pains, where you feel the pains. Yeah.
What people don't know is crisis occurs anywhere. It can happen anywhere. I have told people, so I told some people that while growing up, I had crisis in my teeth.
Wow.
In my teeth. And this usually used to happen during the Harmattan period when the cold is really much. I've met people on our sickle cell community who say their child is having stomach crisis.
Yes,
Stomach
that stomach
crisis.
crisis is, I think it's common, especially amidst
Yes,
children.
in children, yes, and it is something that can be so painful. I've had pain in my ear, just because this thing is where the blood clots. So the blood can clot
Exactly,
anywhere. The
anywhere,
the
and that's where you
oxygen
feel
can
the
stop
pain.
flowing anywhere. Yes. So it is something, and the reason why I'm saying I really, really pity those babies is because these babies are being carried. A baby who is crying, they are carrying him or her, trying to pat the child. They don't know probably where they are trying to carry the child is where the pain
The
is.
pain is.
So it is a very excruciating pain. While I was growing up, my mom knows to be careful not to touch where I'm having the pain, because any little touch, the pain will increase. And my mom has also had to, do sleepless nights. She has to, if it's my leg or my back, she has to use her hand to rub all night. If she, just for me to get, even if it is 10 minutes sleep. And if I should be able to get that sleep, and she just dozes off a little bit, and maybe I wait to rest upon that place, I'm going to get up and shout and scream in pain. And she'll have to apologize. And so it is a very, very painful experience. So sickle cell crisis can occur anywhere. I've had people talk about their jaw, which has happened to me as well. So it is not a joint pain. It is not arthritis. It is not whatever. It is sickle cell crisis. It can occur anywhere in the body. I've
That's
had crisis in my head. It is the worst crisis I've ever had, and I don't pray to have it because while I was growing up, I had the most severe crisis one could ever have. During the middle of the night, people will hear my screams from the third street because it will be as if my bones are on fire. And someone screaming on top of her voice in pain and crying will definitely have an headache. So I was experiencing both headache and crisis in my head. I was able to know that this was where the headache was happening and this was where the crisis was happening. It was that bad. And imagine not being, trying to scream and trying not to scream. I don't even know how to explain it, but it was very, 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 very excruciating. And I had to hold my head. I don't make hairs like the way others used to make because I fear such. I don't ever want to have that. So things like that really, really happen.
I love the way you're so practical, and it would help people to really know what sickle cell is and to know what to expect so that they will be able to make an informed decision. Should I or should I not? So it's good as you are being practical. Okay, now let's come to the financial implication. How was it growing up? Can you just tell us how is it something easy that you just say, okay, I have everything, at least I am rich, I am wealthy, I can manage it, I'll just take my child to the hospital and that is all? What is the financial
Right.
implications for this condition?
Okay, thank you, ma. What people should have at the back of their minds is that you just giving birth to a sickle cell child, just know that the child is going to be on medications all their life. Yeah, and it's not about, okay, I'm going to just spend money on drugs. No. One visit to the hospital can take hundreds of thousands from you. And my mom used to spend hundreds of thousands. I'm talking about many years back. I'm talking about 2006, 2008. 100,000 wasn't a small money then, you know. And
Even now,
if I could,
100,000 is not a small money.
yes, I know, ma. Yeah, right. So I'm just saying, as at
Yeah,
that
I
time, the
understand.
money, the value was higher than now. And one thing my mom really did for me, which touches me so much, and I'm really grateful to her for, was the supplements she put me on while growing up. My mom bought this forever living products and placed me on it, and it made my life easier. I think I started it when I was 6 years old. you know a friend introduced it to her. A friend was a marketer of this forever living products. They were very popular then. So my mom bought them for me. As at that time, I know my mom spent 50,000 naira to buy for the one that will last me for a month. And I'm talking about year 2000, from year 2000 that I remember. And these drugs actually helped reduce crisis a lot. My visit to the hospital was like maybe 3, 4 times a year. Three, four
Wow,
times a year.
which is still
Don't
manageable.
push it. Yes. At most 5 times a year. So and those 5 times a year is going to cough up hundreds of thousands from her. And I've had to face there was a night, it was middle of the night. I had severe crisis which my mom could not manage at home. She had to take me to the nearest health center, and the injection I was given made me almost lose my both legs. I was not able to walk. I lost control of my two legs. And she had to later take me to UCH, the teaching hospital, which I had to spend 2 good weeks before I was able to even gain control of my legs. And I remember very well that my mom spent up to 200,000 because they had to buy this very expensive and painful IV drugs. I remember very vividly. These antibiotics were so painful that each one that was injected into the cannula will burn that cannula.
I
They,
understand.
I use one cannula per each administration of this drug, and I
The
take it
pain
four
of
times a
setting
day.
the cannula, the pain of
Man,
the
yes,
crisis, the pain of the
yes,
injection. Hey, God,
yes, yes.
it's not.
And I remember being happy because the very first day they administered the drug, I was able to even feel my legs. It was so, because the trauma of thinking I was never going to be able to
Okay,
walk
okay.
was also there, you know. And it still puzzles me today that how could injection that was given on one side affect both legs, you know. But it happened to me. It really, really happened to me. And at a point, my mom had to sell lots of valuables just for her to buy my drugs and um, pay for my medications and my hospital bills. And let me emphasize say something, ma. The supplements that I was placed on, the reason why I'm so grateful to her about it is after I used it for maybe I can't remember how many years, maybe 10 years or so. Even after, oh my god, even after the I stopped using those drugs, this drug still helped me for many more years, you know. It helped my listening. Ma, I'm so sorry, there's this mosque
The
beside me. I
noise.
hope you not just want to stop
Okay,
me.
hopefully the noise would stop, but it's not too
Okay,
loud, so they can still continue. Yeah. Okay.
okay, thank
So
you.
I think at this point we have to give a shout out to your mom. She did a very good job in, yeah, no, it's not easy. Raising
Thank
a
God
child
for
with this condition is
yes.
not easy. So
Yes.
we give
And
a
even
shout.
as old as I was, even at the age of 20 something, she will still carried me on my back when I had crisis.
Oh wow. Oh wow. Oh wow.
Yes,
Wow.
yes,
So that's a sweet mother. And I have seen parents, I have seen relatives, I have seen siblings stigmatizing sickle cell patients. Like it
yes.
has come to the point that even people that are close to you, that are supposed to show you love, that are supposed to care for you, are even the ones stigmatizing you. So at this point, I want to ask you, what do you have to say about sickle cell stigmatization? And have you ever been stigmatized? Can you share your experience on this subject?
Oh, many uncountable times. But I'm lucky. I don't know if I should say I'm lucky or not, because if I had siblings, I don't know if the stigmatization would have been worse or less, you know. But I feel sorry. I have lots of friends that are stigmatized by their siblings even right now, and it is really, 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 really touching
No,
and
it's still
painful.
manageable when it's an outsider that is doing that. When it's now people from
Exactly.
the inside, it becomes worse.
Yes. What people don't know is these problems that sickle cell patients have is affecting their mental states. You can't
Mm-hmm.
see a sickle cell patient that won't have what should I how should I put it, agitation, um, flaring up, getting angry, many things, you
Yeah.
know, and
Because of what they're passing
it
through.
comes. Yes, it comes as a result of the pain. Imagine someone in pain and someone is coming, oh, sorry, my dear, and it is exactly the place that is paining them they are
That
coming
is
to
touching.
pat. Yes, and I just shout on you, why are you even touching me? I don't need your touch, just leave me alone. They don't know what the person is going through.
Mm.
And what they don't know is that it might be at that point that the person was feeling little relief, you know, but having that touch would just intensify the pain. So actually, me, while growing up, I don't know if I should say I'm luckier than other sickle cell patients, because in school, my classmates, even though it's not all of them, but majority of them showed me love. But even the few that didn't still affected me, and a few teachers as well, you know, they just say, I know that because of your health, you won't be able to pass the exam. So don't feel bad about it. But it surprised them that I will even be the one that will come top in my exams, even more than those that came to school every day, you know. And the majority of stigmatization I had was actually in the hospital. Um, I have I have faced many, not doctors, though people there are people that have been stigmatized by their doctors, but I was stigmatized mostly by nurses, you know, telling me that I'm pretending, and telling me that I'm just seeking attention, and so many things that. And I don't know about others. I'm a very emotional person. I don't know about other sickle cell patients, but I believe many are emotional. And one thing I hate, just my own personality, is being accused. I don't like accusations because I'm a very blunt person and I just say it as it is. So if I tell you I'm in pain and you accuse me that I'm lying, it is very painful to me, because I'm going to let them know that I enjoy sleeping on my bed, even if it is in a mud house. I enjoy sleeping on my bed than coming to waste my time in the hospital, because every day I have to pay for the bed. And even though I had supportive doctors and nurses sometimes in our hematology daycare, as soon as you are transferred to the ward, you have to meet the ones that don't know anything about you, and it can be very painful. But
Okay, so
let's not talk. Aside from me, I have a friend that is going through such from all her siblings, and it is very painful. Even her own mother doesn't, help her. Even the siblings, some of them have traveled out, and they couldn't even, help her financially, or and still saying she's someone who is on crutches. They are still saying she's pretending. So I don't know what the world is turning into.
and I'm sure
Uh,
she was paralyzed on both legs.
Not paralyzed. She has the hip dislocation, or how should I put it? She
Okay,
needs a hip
okay,
replacement surgery.
okay.
So, and she has not been able to afford it, so she's on crutches for the meantime.
Oh, wow. It is well. Oh, there are a lot of things to be said. All right. Okay, so now in one of your videos, I heard you say, okay, before I go there, has there been times that you talked about the nurses. I know nurses are trained to be compassionate because I am a nurse, but I wouldn't want to say, I don't know, we have our
For
individual,
everybody.
yeah. So I wouldn't want to say about the particular kinds of nurses that you met. But I know nurses are trained to be compassionate. We are compassionate. If you meet
Yes, I have
me,
very good friends that are nurses. Many of
and
my best friends are nurses.
I have actually nursed sickle cell patients, so I am proud to say that. Okay, so what I'm trying to say is, there are sometimes that they would have given you in fact, the most potent injection that they think should be able to abase that pain, and it's still
Yes,
like this pain is not going down now. And I understand
exactly.
the pain, sickle cell, the crisis, the pain they go through, and at that point they feel like, give me more injections, give me more medications,
Mm,
bombard me, and we can't give you overdose. So at that point that we've given you the one that we know is okay for you at that time, we have to wait for the effect of that medication to wane before we can administer another one. So I understand that part. Most time it causes friction because you'll be like, no, I'm still in pain. Give me more. The nurse will be like, I cannot give you. Why are you? I have given you what I should give you. So why are you still in pain? So I understand that
Yes,
part.
and to add to what you said, you are very right. But one thing we faced while growing up was there was no release. We now have the analgesic charts and all those things. They were not really there, and we have the palliative care that measures your pain. You can measure your pain on a scale of
Yes,
1 to 10.
yes.
All
One
these
to
things
10.
were
Yeah.
not there. All these things were not there then. So it's also
You're
added
right, ma'am.
to what caused all those things.
All right.
Added
So
to it.
I have cleared that part. So I am sure that there have been times that they have given you analgesic to wane the pain, and it's like,
Yes. Ah,
the thing is
sorry, I
not
was
working. Oh.
I was about to say it. Sorry. Yes, it has happened so many times, and I had to keep screaming, begging. But what we later found out was it may be after by the second day or the third day, those drugs will now start, you know, coming down, and you keep sleeping and keep being drowsy and all that. But at that point, all we want is a relief, and
Yeah, we
I know
understand that.
I know that they are trying to explain to us, but
The
I
pain
don't
will
think
not even allow
anybody,
you to hear that.
yes, to be reasonable. Exactly. So,
Mm.
um, since we don't know that, but what they know, there should be a way to, even though, of course, there are sickle cell patients that don't have good attitudes. We are not saints. We
Yeah,
have
definitely.
terrible, yes, yes. Some of us are even spoiled because we
It's
are sickle
everywhere.
cell patients. Our parents spoiled us. Some of our parents spoiled us, even though my mom didn't spoil me, although I'm only child. She was very, very strict, but we have patients, other people like that. So I understand that there are some that might be rude to the nurses and all that, but
Yeah.
there's
So
um there's
sorry, ma. I
there's
think at this point we'll be getting faster because we are spending 1 hour already. We are using 1 hour already. So, okay, now let's talk about the side effects of medications, because you talked about the fact that sickle cell patients will be on medication for the rest of their lives.
yes,
So some would
yes,
visit the clinics every month like that. Some is even weekly, twice in a month like that. And they have to be given medication every now and then. So what are the side effects of this medication? Because there is no medication without its side effects. No matter how safe it is, there will be a side effect. So what side effects do you have as an individual? And what other side effects? Because I know you have friends that are also sickle cell warriors. So what other side
yes.
effects have you heard from them? Yeah.
Um, the most ones that people actually medications, because they vary from each other. Some don't just cause ordinary side effects. They cause complications for people.
Complications. Yeah.
Yes, yes, for people. There are people that have developed liver problem, heart
You're
problem
right.
because of that.
You're
There
right.
was a time I had a kidney infection that it was God that saved me, but I've had to deal with indigestion. But right now, the most serious one I'm having is dealing with memory loss.
Hmm.
It is very terrible to the extent that I might not remember what I just said a few seconds ago. It can be that bad, and um, it's I don't know how to put it. It is painful because these drugs, you can't stop them.
Mm,
You have to lean
keep
on
using
them. You
them.
have to depend on them. Yes.
Mm.
So that is why these things are happening. But I have, in fact, I have a little friend. He's a small boy of, I think, 6. Is battling with the liver problem, and is as a result of being bombarded with lots of analgesics. So it can be
And you know that
this
the
drugs.
more you use some of these drugs, the more you start getting resistance to that drug. So at a
Yes,
point, it will be
resistance.
like,
Yes,
yeah, it will be like that drug is no more working for you. They have to give you something higher than that because you can't use something lower. It won't work. So they have to give you something
yes.
higher. At a point again, you get resistance to that particular drug. They give you something higher. And the more you are getting something higher, the more you are having more side effects. And in fact, the point of complications.
And sickle cell patients also are at risk of falling addicted to drugs.
Yes.
We have many sickle cell patients that are falling addicted to drugs. I was addicted many years ago to a particular injection, and it took me in fact, many years. It took me many years to come out of it, and it wasn't easy for me at all. It wasn't easy at all because um, we have the fear that the pain should not come, you know. We have the fear that we don't want this pain to come. So, but now having that fear is going to make us want to try. Our mentality is maybe we can use these drugs in advance for this pain not to come. Yes, because the fear of the Lord is the beginning of wisdom, but also the fear of pain can bring foolish wisdom as well. That is just what people don't know, you know. And it is really painful. I feel for many sickle cell patients, and we don't have a good health care in Nigeria for sickle cell patients. So many sickle cell patients that don't have people supporting them financially, they just have to do self-medication. They have to go through self-medication because I just want to set my eyes on doctor, I have to pay consultation fees, you know, which is really painful. But I had the privilege of having good doctors that helped me while growing up, which many other people didn't have that privilege.
Yeah, not
And
everybody
it is
have the
very
same
painful.
opportunity.
Yes, I've had times when I had crisis from school, and I didn't even tell my mom. I just went to the hospital, and by the time my mom will even hear, I'm already getting better. I mean, maybe I went in the morning, by evening my doctors, they fed me, they've given me all the drugs, they've paid for the drips, they've paid for everything and my test, and they just call my mom because they know if she came when the crisis was much, she might, she'll be shaking and all that. So they'll just tell her to come and pick me up in the evening when I'm getting better. So, but many sickle cell patients didn't have that luxury. So it is something that many of them have to deal with. And another thing in this side of the country, in this side of the world, this country has done to we sickle cell patients is calling us Mary and Ogbanje, because
Because
while
they're
we are
always
in
falling
pain,
sick.
yes, no, aside from that, when we are having excruciating pain, we shriek, we twist, so they think this person has an
There is
evil
a
spirit.
spirit in her.
Yes, there's a spirit controlling her, and it's also part of what causes all this stigmatization as well. It's part of it.
I'm
So they
sure
say,
this condition has affected your studies.
yes, ma. Yes, it has. But let me just make you laugh a bit. This Emere something. My mom's elder sisters had to take me to a church where the white garment people,
Oh,
they
wow.
beat me with brooms. Yeah, with 7 of them beat me with 7 brooms to chase the evil spirit out of me, and I had brooms stuck in my body, and my body was bleeding from head to toe. So, and my mom could not, she wants any miracle and anything. So, but after that, when I landed in the hospital, she learned her lesson. So, so Another thing is people, many parents that force their children, their sickle cell patients to take herbs. What they don't know is these herbs, they contradict the drugs they are taking, and it gives many people kidney and liver problems. So I beg parents to please don't, even if your child is not a sickle cell patient, don't give them herbs just like that. Don't give them herbs just like that. There was a time I was admitted in the hospital, and they brought this child from a village.
Mm.
This child didn't even know she had sickle cell. As by the time they brought her, it was too late. She was in the last stages of liver problem, and her stomach was very swollen, and she lost her life, to herbs, because it was herbs they gave her while growing up. They didn't even know what she had was sickle cell. So it was too late, and yes, so please, it is something we face here as well. So I'm sorry, Ma, you said something.
Thank you very much, Ms. Tomisin. I understand.
Yes, ma.
Okay, you have really expatiated a lot and lots of I know that as many as are watching and will later watch this video because it's been recorded, it will be uploaded on the YouTube page, Godly Women Matters, and it is live on Facebook, so it would be there. In
Okay.
case you missed out of this, you can rewatch it.
Okay.
And I would also like you to watch a video on YouTube that is titled "Are You Compatible?" Like, just go to the Godly Women Matters YouTube channel. "Are You Compatible" is a video on YouTube that I made. And there I was able to break down this compatibility. Although there are different
Okay.
compatibility checks, not just the genotype test. So I talked about all of those compatibility checks. And I also talk about the genotype compatibility. So I will
Ma,
not be able to
I'll
talk about that
appreciate
in
if you
this
can.
video. Okay, ma.
I'll appreciate if you can give me the videos to put on my channels, because I can't download from YouTube to my phone. So it's very important, because people need to understand how the compatibility works.
Yes.
Many people don't understand. I personally don't have a full knowledge of it. I just
Mm.
have few ideas. So it's very important.
All right. So we won't repeat it in this video. Just go to Godly Women Matters on YouTube and you would see those videos and other videos that would help you in this singlehood journey. All right. Now,
Okay,
as
and
we are
so sorry,
rounding
ma.
up. Okay, ma.
Sorry, ma. I want to add to this. I couldn't say it because of what I was really too passionate about what I was saying. According adding to the cost complications, financial complications, I'll just quickly talk about when I wanted to have my son. I had
Okay,
to
that
deal
is
with.
where I am coming to now. So let me just ask this
Okay,
question so that you would put everything together. I hope
yes,
you will
ma'am.
not forget.
I will
Or should
try.
I
I will
allow
try
you
my
say,
best.
okay, probably you should say that first and I would ask my question because I am coming to
Okay,
the parts of your child, your son and pregnancy and all of that. So I'll still come. So say what
okay. I
so that
thought
you
you
don't
wanted
forget.
to round up. That's why
No,
I
I said
said I talked
yes, so
about.
that we will just use that to round up. But say what you have to say because I wouldn't want you to forget that.
Okay. Well, I had an early pregnancy at the age of 17. So it was tough, very tough for me dealing with teenage pregnancy and sickle cell together. I'll just summarize. I won't go into too much detail. So getting pregnant at the age of 17 was something I totally didn't prepare for. And my mom didn't, it came as a very big shock. And after being faced with this, I thank God I had very loving doctors. They had watched me grow up, and me facing that time of my life, they all supported me very well. But even with all this support, I'm going to tell you it was very, very tough. It was
Hmm.
very, very tough, because first of all, my mom had to put her house on sale, the house she built, and we didn't get a buyer on time. So I suffered, we both suffered while I was pregnant. And we had to vacate the house due to some reasons. So we were staying in a church while I was pregnant. The church didn't have windows, didn't have doors, and I had to deal with eating just once a day in the night. And Let me just speed up. All these things,
I can
the
hear
reason why
some
I'm saying that,
echoes. Is it from you?
oh, can you hear me?
Yeah,
Is it
better.
me?
It's better now. Yeah.
Okay. Okay. So why I said those things is because these things I faced actually put a toll on my body, and excuse me, I fell seriously sick. I fell
Hmm.
sick. So at the age of sorry, at the time my pregnancy was 5 months, I had to be placed on the bed in the hospital.
Bed
I had
rest.
to be admitted. Yes. So um it was very, very serious that I couldn't breathe. So
Hmm.
from 5 months, I was placed on oxygen. I was placed on oxygen, and it was very, very painful because it was painful to breathe. It was painful to breathe, and it was how do I put it? It was terrible. It was hard to breathe as well. It was hard to breathe as well. So also the baby was not in a good position. He had the umbilical cord
Around
round
this.
his neck more than once, so it was choking him as well. So he had to depend on the oxygen I was taking as well. So, and then these doctors had to later move me to the labor ward, or a kind of ICU. I don't know what it was. I just know my mom had to pay for the machines every day. So I had a different machine on my body and another one on my stomach 24 hours that was monitoring my baby. So it was everything were costing millions for my mom.
Hmm.
And then I had to go through the pain of lying on one side for a very long time because of the machine, and it was just really, really costing mommy a lot of money, the drugs I was taking, and everything. So actually, can you hear me?
Yes, I am.
Okay, so fast forward to 7 months, 3 weeks, I did the cesarean section that brought out the baby, and he had to be in the incubator for another 2 months.
Hmm.
And I had a very slow recovery, a very, very slow recovery. The cesarean site didn't heal up on time. I developed infections, you know. I developed high blood pressure as well. I developed high blood pressure. I remember so well, my blood pressure was over 200 for a very long time.
Oh.
Yes, yes, it was. I was just hanging on a thread. I know that so well. I couldn't even move to the toilet. My bed rest was really, really bed rest. I was not allowed to walk to the toilet. So it was that bad. And even I had to wait 13 days before I was allowed to go and see my baby. I was yes, because of the complications, and the baby also developed jaundice, so many things that my mom had to spend money on as well. So altogether we spent 4 months in the hospital during pregnancy and after pregnancy, which cost my mom over a million or more, million naira or more. So it is part of the cost complications. I'm not saying all sickle cell patients go through that. I'm not saying all shh, I'm not saying all sickle cell patients go through that, but I probably, because I had teenage pregnancy, I went through that, and it wasn't funny. So we have different bodies, and our bodies vary from each other. So even though they vary from each other, every sickle cell patient has to spend so much money during all this period of time. I have friends that went through normal delivery as a sickle cell patient. So I'm not saying every sickle cell patient goes through this, but I'm just emphasizing on the cost complications that I personally had to go through with my mom. Can you please excuse me? Thank you.
All right, thank you, Ma. So, like, that was what I wanted to ask from onset. I heard you said in one of your videos that sickle cell crisis is as like it's more painful than labor pain. At that point, I was like, are you serious? Like, are you so sure? But understanding the fact that you are a mother and you have gone through labor pain, I decided to agree with you.
Actually, I didn't go through labor pain. It was confirmed by one of our in fact, not one, many of our sickle cell patients that have gone through labor pain. I didn't have to go through labor pain because I had him 7 months, 3
Yes,
weeks.
okay, all right.
But the other people who went through labor pain are telling me that, letting the sickle cell community know that it is more, sickle cell pain is more painful than um labor pain. And after having the accident, I had the fracture on my hand, whereby many of my doctors didn't quickly believe I had a fracture. Like, when I newly had the accident, they were doubting I really had a fracture because I wasn't crying like the way people cry. And people they had to, some of them called me, even the ones that were not my personal doctors, that were just seeing me around. They were like, "You, this girl, are you sure that you had an accident in this?" And like, what exactly is going on? I said, I'm in pain, but it's not as painful as crisis, so you don't expect me to be. And also, i've been I've been able to train my body. I've been able to train my body to endure so much pain. I kept getting embarrassed with my screams and shouts at the neighborhood. So sorry, ma. I remember I've not answered my question about the school, about my education. Are you there?
Yes, I'm with you. I'm with you.
Okay. So I'll just say it together. While I was in the hostel in the Polytechnic, I've had to be taken out at midnight because of crisis,
Mm,
which was very terrible. It was a very shameful, embarrassing thing, and it wasn't once or twice. So I had to build my pain endurance a lot. And staying with my son, I have had to also practice enduring my pain so as not to be crying in front of my son. So
mm,
all these things have helped me to build my pain tolerance. And I had to drop out of school because, first of all, during my first year in school, my the the second semester, I had terrible crisis that really affected my performance, because I was all shaky and pale, and in fact, I just dragged myself to the exam center. I've had people that wrote exams on the hospital bed, but I don't think I think it's only happened to me once in secondary school. So um, along the line, because of the money I had to spend on the hospital bills, I was not able to. Me and mommy were not able to bounce back to pay for my school fees. So I had to drop out, and for
mm,
other reasons as well. So I
mm,
was not able to finish my higher institution.
mm. I have heard of some other sickle cell warriors that in their place of work, at that point that they start having crisis, it's not
Mm.
their fault. They have to leave that work. And sometimes
Yes,
they have to take break for like 1 week to recover and come
I've
back.
lost.
And before you know
Yes,
it,
ma. I've
another
lost many
crisis and
jobs
like
too.
that. So they are
I've
not
lost
able to
many
sustain
jobs.
the job.
Yes, I've lost a number of jobs from sickle cell crisis.
Mm,
And there are some people, after I lost some jobs, when they told me not to come back after they saw the crisis. So what I did was, whenever I went to apply for a job, I just told them immediately that I'm a sickle cell patient. So if you want to employ me, you employ me, which they all refused to employ me. So
mm,
it was better than me just wasting my time until many years later, I got the opportunity to work under my doctors for a few years. So, well, before that, I lost so many jobs because of that.
Hearing your
It's been the
story, I
life.
have seen that you are the one God has shown mercy. You are so graced. The
I
pain
am.
is not as severe as some others, and you had the right kind of people beside you. So I want
Yes.
to ask you,
Yes.
how has knowing God, being a believer, helped you in this journey as a sickle cell warrior?
Oh, ma, it has helped me a great lot. And the reason why is because um God showed himself mighty in my life. Bring the table here. God showed himself mighty in my life because I've been at the point of death so many times,
Wow.
like so many times. Yes, there are many times. I don't even think my mom was aware of some of them. I remember not. Where's the light? I remember not waking up after a certain surgery
Hmm.
for many hours, and where they were all thinking I was going to go into a coma or whatever, and God still brought me back after some hours. So it has really actually, let me start from this point. I At a certain stage I stopped believing in God. I told you
Had
grew up with
faith.
hope.
Hmm.
Yes, I was made to believe I was going to be healed one day. And after waiting a lot of years, I said, okay, probably God is not ready to heal me. So let me just wait for my death. And, believing I was going to die early, I just waited. There are many prophets that told my mom she should expect my death at the age of 18. So all these things all these things contributed to all that I faced. And but the more I stayed further away from God, the more God drew closer to me. Even when everybody abandoned me and I thought, okay, this is the time I was going to just die, and he just kept popping up and letting me know he was still
Can be
there.
sure
And
of the love of Christ.
exactly, especially when it's really really dawned on me that my dad was not coming back. I i had a mental breakdown. Yes, I was psychologically affected when it dawned on me that my dad was not coming back. So all these things really really affected me, but you know God kept coming through for me. I even stopped going to church for many years, but I just saw that when I was in trouble, I call on God. I even told God those severe crises, the embarrassment. I told him I didn't want them anymore. I'm not saying I don't want to, I'm not saying crisis won't happen, but stop giving me embarrassing crisis that
Hmm.
will make the whole community to hear about my cries. And it happened. I'm not saying I didn't have severe crisis, but I've not had the crisis that made me scream down the whole neighborhood, in many years. And the more I've continued drawing closer to him, my perspective about life has really really deepened, and it has made me to understand things more. So it's really sweet serving God
It's
because
sweet. It's sweet. It's so sweet
he's
serving God.
the only one. Yes, he's the only
Even
one
when
that
every other person deserts you, you are sure of the love of
exactly.
Christ. He's the only friend that
Yes.
sticks closer
Yes.
than a brother.
Even my mom got tired and stopped. I didn't
You
see her
won't
for a
blame
few
her. It's not
years.
easy.
I can't. I didn't blame her.
Mm.
I actually, okay, I did blame her, but later on, I didn't blame her again. I did blame her, but I didn't blame her later on, seriously. But what I'm saying is, even if my dearly beloved mom could abandon me, God, when she abandoned me, God didn't. And I'm so
Scripture
grateful
even
to Him.
recorded it. Even if your earthly parents, your earthly mother would abandon you, said, He will
Yes,
not,
yes,
not,
yes, yes,
not
yes.
forget you.
So Yes, ma.
Thank you very much, Ms. Tomisin. Okay, as we round up, can you just give, in summary, any advice for the masses hearing us, especially singles
Okay.
that think when I get there, I will be able to cross it. Let me just get married first.
Okay, please, I'm begging. But before that, ma, can I ask you a question since you're in the medical line?
All right,
I've
ma.
been hearing of this procedure whereby through IVF you can choose your baby's genotype. Is it? I told people I was going to confirm. Is it real?
I think what they do is, at that point that the baby is forming, they can get, it would get to some months, they can check and tap the blood from the baby and check
Oh,
the genotype. You get, so
oh,
at that point,
it's
if
not
they
that.
check the genotype, because I am not in support of that procedure actually. If they check the genotype and it is AA, they leave the fetus. But if it is SS, they terminate the fetus. So that's what they do. So
Wow,
that's what they say, they are
wow,
selecting. So when the baby
wow.
is 1 month, 2 months, 3 months, it starts having, the blood starts flowing in the fetus. They get the blood check, and if
Okay.
it's SS, they terminate the fetus. So that is what they do. I'm not in support of that
Oh, I
procedure.
thought I am not as well. I thought it was something that we could screen the whatever and do IVF. I
No, because they
actually
have to get
I
the
didn't know.
mm.
I didn't know. So I advise singles out there, please, I beg you. It is not worth the stress. It is not what the pain you are going to make the child go through. That love, that one you're thinking loves you and you can't do without. Trust me,
Mm.
you can do without them.
I tell
You
you, when you
I
start passing through and facing all of these pains, and you forget the love.
Yes, you
Mm.
forget it. You know, you now have to question God and question your life, your existence, and so many things. And that child, trust me, that child will blame you. That is just what you don't know. That child will blame you because, and also no child deserves to be given a life of pain because every human being has to go through a hard life. Even if you are born into so much wealth, you will still
The
go through
silver
one
spoon.
hardship or the other. Yes. So I don't think I said in one of my TikTok videos that went viral, I said the world is already full of hustles and bustles. So why will you come and add to that um pain and everything you have to go through? Why when you can just avoid it? Mm? There
Mm.
are many regrets we have in our life later on. Had I known. So if you can avoid this had I known, why not just do it and stop ignoring the fact that love conquered all, but not sickle cell. Trust me, not in terms of sickle cell. There's no love that's even you yourself, even if the man is supportive, trust me, you yourself will get fed up at a point. And I also want people to cancel the notion that sickle cell patients die early. It is not true. Yes, many people have
Yes,
died,
I've died,
but
yes.
even people that are not sickle cell patients, they die every day. But don't bring that idea and scare anybody. I've had people tell me, are you not expecting your death? I'm not expecting my death.
I got
We had one of our oldest sickle cell patients that died, I think, at the age of 94, 2 years
mm.
ago.
Mm.
And I have one of my mummies that is 50 something years old right now. We have many of them, and I will be 30 this year by God's grace. And my mom let me know that she and my dad told God that I will I will live a long life. And the Bible says the child will die at 100 years old.
Mm.
So all these things, please stop scaring sickle cell patients. Stop scaring sickle cell patients. It is not what it. And I'm going to add this. I wasn't actually the only child of my mom. My
Okay.
mom had three children. I'm firstborn. I've been the firstborn. I had two younger ones, which died of other circumstances which were not sickle cell at all. They were not even sickle cell patients. They
Okay,
were
so you are the
never
only
sickle cell
surviving
patients.
child of your mom.
Yes, yes. I don't remember them. They were so young. One died at the age of 2 and the other died at the age of 6 months with pertaining to other circumstances. So please, let's cancel that notion, ma. That's all I can say. Sorry,
Thank
ma,
you
my
very
battery
much.
is low.
Yeah, you have tried.
Yes,
We are rounding up already. We've spent like 1 hour, 20 minutes or
yes,
so. So thank you
yes.
very much for your time. We have
Yeah.
gained a lot. We have gained a lot. Thank you very much. I saw a question on Facebook.
Okay.
Someone said, what if I live in a country where genotype testing is not believed and I can't get anywhere to do any genotype test? What can be done in that? What can be done in a case where you are in a country where they don't even believe in genotype testing?
You're right. You're right. I've had people on my live, on my TikTok live from Sierra Leone and Cameroon and all Kenya, all those things where we see these people don't have care for sickle cell, they don't have genotype this thing. I really don't have an answer for that, but I pray God will give them a breakthrough very soon,
Yeah, because I
honestly.
believe we are in a
If you
period of
can,
civilization and people are
if you
getting
can
to
afford
know.
it, if
Ma?
they can afford it, I said
Okay.
if they can afford it, you can send your blood sample through online to labs that are outside
All
if you can
right.
afford it. That is the only thing I can think of for now.
Hopefully countries would make availability for this because they are beginning to see the implications of these conditions. And you would see that in
What
countries like that, they have lots of these sickle cell patients as a result of this. But with civilization, hopefully they would be coming up. I hope so. So thank you very much, Ms. Tomisin. I'm very grateful. Shout out to Opeyemi, Victoria. She joined on Zoom. Shout out to Ikpefuran, Oluwasayo. She joined on Zoom. Shout out to my husband, Pastor Nelson. Thank you for always supporting me. He joined on Zoom. And shout out to everyone that's joined on Facebook. God bless you. And because we started with prayer, we are ending also with prayer. Can we just share the
is
grace as we round up? The grace of our
okay?
Lord Jesus Christ,
Lord Jesus
the love
Christ,
for
the
God,
love
and the
of God,
fellowship of the Holy
fellowship of the
Spirit
Holy
be
Spirit,
with us
be
now
with us now.
and forevermore. God bless you, everyone, for joining. You can share
Thank
this
you for
live.
having me. God bless you.
God bless you, Mr. Missy. I'm so grateful. Thanks for the practicality. Thanks for being opened. In fact, I have even gained as a nurse. I have learned some things that I don't know before. Thank you very much. Okay, bye. I'll be
Please, ma,
closing.
share your Facebook link. Oh.
Ma, the Facebook link.
Please share your
Yes,
Facebook
Facebook
link.
link.
Yes.
I would send it to you immediately. Thank you very
Okay.
much and